Hello and welcome, ladies and gentlemen, from wherever you're joining us. Good afternoon from West Africa. Good evening from East Africa. I think good evening from Southern Africa, and good evening from Northern Africa. We are so delighted to have you today. We are super pumped up for the session that is ahead of us. My name is Dennis Tunya. I am the head of education and training at Starkey in Africa. So today we have a great session planned for you all. We are super delighted that you could be able to create time to join us today. So once again, ladies and gentlemen, feel very welcome. We are happy to have you. I'm hoping we can be able to confirm the attendance in the next 3 minutes, perhaps, so that we can be able to kickstart and get ourselves rolling by around 16:05 the East African time. So once again, ladies and gentlemen, feel free and come on, drop us all the questions you probably could have, and let's get to interact. Once again, feel very welcome. So keep the questions coming. Thank you so very much. Thank you very much. I think we are good to go. We have a quorum now. So, once again, ladies and gentlemen, at Starkey Africa, we are committed to making sure that whatever professionals that we work with know what they're doing. Because we believe that what is good for the patient is obviously good for the professional and good for Starkey. So we go over and beyond to give you all the support that you need in terms of training, in terms of product information, of course, working with the fundamentals that you perhaps have acquired from your course and years of study and practice to make sure that whatever you do is good for the patient, good for you, and obviously good for us. So today, we have listened to some of the questions that you have asked us. We have had questions asked about the types of hearing aids that are there, and obviously, just to pick it up, just be able to get us started. Typically, we have two types of hearing aids. We have standard hearing aids and we have custom hearing aids. So standard hearing aids would require that you take an ear impression and you send it to us, and we can be able to customize something just for the patient. Some of the details of this, the custom hearing aids, are things like IIC, the invisible in the canals, the CIC that is completely in the canal. We have the ITC that is in the canal, and then we also have ITC half shell, which is slightly bigger. It's in between an ITC and an ITE, which is in the ear. Those are the custom hearing aids. That's the range of custom hearing aids that are provided at Starkey. We also have standard hearing aids. Standard hearing aids, we have the obvious receiver in the canals, the BTEs, and of course, at Starkey, we have a BTE Power Plus that can be able to amplify hearing losses of between severe to profound. This could be an equivalent of candidates who are probably for cochlear implants. So at Starkey, we are a one-stop shop for all of your patient's hearing needs. And this is what we make sure that we offer to you, so that every patient that comes to you can be able to have the best solution that you potentially can be able to offer. At Starkey again, we are not just about hearing, but we are about listening too. Over the years of the webinars that we have read, you have given us feedback. And one of the feedbacks that you have given is that you want a programming session. You wanted a live programming session. Myself as a trainer, I've traveled far and beyond to make sure that we do the programming live on site on several occasions. But then again, I haven't been to each and every other place. So for that reason, we have decided to bring here a demonstration of a live programming session. So joining me today is a gentleman that is very well known to the audiological sphere and the medical sphere, especially with effects felt, very heavily felt in East Africa. This gentleman is a clinical officer by training. He's studied clinical medicine. He's also endeavored and very passionate about helping people, giving back to people. So he broadened his scope to be able to make sure that he can be able to study audiology. He studied in Zambia, studied in Queen Margaret University in Scotland, and furthered his scope in masters in audiology. So joining me today is one Mr. Isaac Wahome. Mr. Isaac Wahome is the director of Dexter here franchise of hearing here in Kenya. I say franchise because he owns a couple of branches that run with the brand. So he's a very able man, very good. He's a straight talker. I love interacting with Isaac because he's a gentleman that will tell you the truth while facing you. He will smile at you while hurting you with the truth, which is the good kind of thing. Everybody should have a friend like Isaac Wahome. So today, I feel very honored to have Isaac Wahome join us today. Welcome, sir. Mr. Wahome, good to have you. Mr. Wahome, can you hear me? Shake your head if you can hear me. I can't hear you, sir. I can see your mouth moving, but I can barely hear you. 1, 2, mic check, Mr. Wahome. You gotta look at your mic. Yeah, okay. Okay, there seems to be a bit of a hitch with Mr. Wahome's microphone situation. 1, 2, 1, 2. Okay, let's have that quickly checked. So you, ladies and gentlemen, please keep coming and okay, keep coming and please keep sending us your messages, your concerns. We'll be able to tackle them as we keep on. Let's get Mr. Wahome's microphone sorted. We have the ICT personnel on the ground. Thank you so much. So as we get Mr. Wahome sorted, I just want to delve into some of the questions that we have. I have probably encountered as we get Mr. Wahome getting ready up. We have Miss Nu from Uganda. She was asking, does increasing volume manually happen to one hearing aid or from one ear to the other? So for Miss Nu and others alike, Starkey hearing aids have what we call an NFMI system, that is near field magnetic induction system. So typically what this does, it enables that while you add volume on one hearing aid, the other one automatically adjusts as well. But this you have to be able to preset while you're doing your programming. When you're putting your user controls within the software, you drag and drop on the left, and then it gives you an option. Do you want it to be an ear-to-ear communication, or do you want it to just be that if you add volume or if you manipulate one particular hearing aid, it will only work within that one particular hearing aid? So if you put within the software that it can communicate ear-to-ear, then with the help of the NFMI, which is the near field magnetic induction, the left hearing aid can can work with the command that you have given on the right hearing aid. This technology, the NFMI, also helps whenever you're fitting a cross or a bicross. By the virtue of fitting a cross and bicross, obviously you have a transmitter on the dead ear or the non-responsive ear, and then you probably have a microphone on the other ear in case it's a cross, or in case you are putting a receiver on in case of a cross, or you're putting a microphone in case of a bicross. I just want to have it clear again. In case you are fitting a cross, you have a transmitter on the dead ear and a receiver on the better ear. In case you're fitting a bicross, you have a transmitter on the dead ear and a microphone on the other ear. So this, with the help of NFMI, which is available in all of our Starkey hearing aids, you can be able to fit binaurally, and of course, enable the hearing aids to communicate binaurally. I would love a signal once Isaac Wahome is set. Please just let me know and please bring him on board. We can be able to let him run. And then another question was asked by Mr. Roland. What is the best prescriptive target when fitting a cookie bite audiogram? So, whenever you're fitting Starkey hearing aids or any programmable hearing aid, there comes a point in time when you allow the algorithms within the hearing aids, depending on the fitting formulas that you have probably chosen, if it's an adult or if it's a pediatric, and then you give the hearing aid a best fit option. I mean, you give the software a best fit option. It will be able to monitor the frequency levels and of course the volume levels, the thresholds. I mean, to be able to give the best listening experience for each and any type of audiogram. It doesn't matter if it's presbycusis, that the high frequency drop audiogram, or it's a cookie bite audiogram, or it is a reverse slope audiogram. Whenever you give best fit, the patient will be able to get the best listening experience from our Inspire, Starkey Inspire and Profit softwares. Then I'm also looking at a question from Grace in Nigeria, who was asking about tinnitus rehabilitation, especially for patients with high frequency hearing loss. As it is right now, currently, there is hardly any sort of direct treatment for for tinnitus across the globe, but we have tinnitus rehabilitation technologies. All of Starkey hearing aids have what we call multiplex tinnitus rehabilitation technology that is able to do, with the help of pitch matching and the artificial intelligence, is able to rehabilitate the tinnitus situations that are in any type of tinnitus. It either could be a roaring tinnitus from people, things like Meniere's syndrome. It could be pulsating tinnitus, which could be from causatives like hypertension, or it could be like the one that Grace is asking about, the high-pitched tinnitus, which is mostly associated with high-frequency hearing reduction. So all in all, at Starkey, we have all, if not every solution to most of the trouble that could present themselves within your clinic. I would love to know if Isaac is here again. Please let me know if Isaac is here. Please keep your conversations there. All right, Mr. Wahome is coming in. You're here. 1 2 1 2. Let me know. Are you ready, sir? Okay.
Can you hear me?
Yes.
Now,
Yeah, you know. Finally.
hello.
Good to have you, man. I can hear
Hello,
you.
can you hear me now?
Yes, I can hear you.
All right.
Welcome, sir.
And my volume is okay?
Yeah, sounds good. Sounds lovely, man. You look great.
So the only thing I can't hear you, Dennis.
It's fine. Let's just keep going. All right, please go on. Mr. Wahome, if you can hear me, please continue. Let me just see if you can be able to get Mr. Wahome.
Now I can hear you.
Awesome. I can hear me through you.
Now I can hear you.
Oh, great, man. So good to have you. So good to have you. So, Mr. Wahome, I was just introducing these people to the great presentations that we have planned for them today. So please just take it away.
All right, thank you very much. I think my presentation today is just a brief presentation that I would like to present on best fitting. I know everybody is looking forward for the presentation. So here is, yeah, so that's my presentation today. And so today we are going to talk a little bit about best fitting. And one of the things that I want to say is that this is a very important topic when it comes to audiologists and hearing instrument specialists, because it's the only way we can prove, especially to the patients, that we are doing things correctly and the right way. And it's basically hearing aid fitting is a process. It's a process that involves selecting, programming, and verifying devices that we want to give to our patients. And the sole reason is so that we are able to optimize communications abilities, and so that we can achieve the best satisfactions from our patients in an evidence-based manner. So when we look at some of the things that we talk about in best practice of hearing aids, we talk about things like the first thing is to make sure that we are able to do a comprehensive hearing assessment, and this involves things like hearing aid hearing tests with pure tone audiometry, speech audiometry, and imitance audiometry. And this is especially for adults. For pediatrics, it's a little bit different. For pediatrics age group, we do hearing assessment using ABR, ASSR, and of course behavioral assessment with play audiometry and so on. And at the end of the day, the most important thing is if we are able to do a comprehensive case history taking. And this will help us when we are doing selection of hearing aids. It will help us when you're programming the hearing aid, just to understand what are the needs of the patient, what exactly are we interested with in terms of lifestyle, in terms of dexterity, in terms of cosmetic needs, and so on. And this one basically follows up with doing otoscopic ear examination. And after that, then we start selecting the equipments, and there are different types of equipments that are there in the world. And remember that hearing aid is a powerful instrument, and it is there to amplify sound. But if it's not used correctly, if we do not program it correctly, then it means that we'll not be able to optimize sound correctly. And that's why we need these protocols and procedures so that we are able to optimize sound, we are able to deliver correctly, and patients are going to get satisfactions. And we have so many devices to select from behind the ear. Dennis has talked a little bit about that. Receiver in the canal types of hearing aids, in the ear type of hearing aids, completely in the canal, invisible in the canal type of hearing aids, and also bone anchored type of hearing aids or bone worn type of hearing aids, and up to implantable. And it is up to you now as an audiologist or an otologist or a hearing instrument specialist now from the basket to select what basically fits your patients. Remember, hearing aid is a prescription. And apart from that, there are many other things that you have to select from. One of them includes things like technology. Sometimes patients will tell you, okay, I need a hearing aid that is able to have Bluetooth connectivity, and I'm able to stream, I'm able to connect it with a listening device, and so on. I'm working as a waiter, and I need a device that is not going to disrupt in terms of the noise that is coming from the plates, the utensils in a restaurant, and even the conversations around that area. So you need a device that basically will reduce background sound and so on. So noise reduction is very, very important. And of course, the directionality of where the sound is coming from is another factor that we come to look at. When we talk about other factors about that are related to hearing aid, include the channels that we want to give, the bandwidth that we are giving, the frequency modulations and frequency lowering, and those kind of things. That you as an audiologist, you have a full bucket to select for your patients. What do you want to select? At the end of the day, you want to set very realistic goals. You want to give your patients what matches the expectations. And the toughest question has always been, how do you how do you meet the patient's expectations? Sometimes patients have very high expectations, sometimes they have low expectations, but setting the realistic expectation is something that is very, very, very important and key when it comes to hearing aid fitting. And of course, there are usually three stages of hearing aid fitting. One of them is pre-fitting. The other one is now the fitting itself, and post-fitting. Post-fitting has got follow-up of patients and so on. So during the pre-fitting stage is when you really want to know exactly what my patients needs, what they want, and how am I going to meet these expectations. And then from that, now it goes to now getting yourself ready after you have selected your device or equipment that you want to fit. And after you have done that, then you, of course, program your hearing aid using the different prescriptive formulas. Of course, we have the NL1 formula, we have the DSL type of formula, and so many other formulas, or even the proprietary formulas for, like in Starkey, the ESTAT type of fitting formula that you can use or utilize so that you can optimize the sound that you want to deliver to your patients. So the prescriptive formulas are very important depending on what kind of population you are dealing with. The DSL version 5 is very common, especially for the pediatric age group, and that's what we like using it for, the pediatric age group. But the other ones, we basically the NL1 or NLA2, we like using it basically for adult patients. After you have fitted your hearing aid, then you do verification or and validation of whatever you have fitted. The commonest verification measures that we use is the real ear measurement. And the real ear measurement in African context and even in developed countries is not very well utilized, because you realize less than 50% of the audiologists actually utilize this tool for various reasons, including time, including cost, all those kind of things. But it's a very important tool that when we're talking about best practices, it's something that is very important to utilize or use. And then we have the validation where we use basically a questionnaire just to measure the outcomes. And we have different questionnaires for elderly. We have different questionnaires for this the general population and so on. So these questions that we ask different patients in terms of the benefit that they are getting. We have the COSI type of questionnaire. We have the AFAB type of questionnaire that we use that are important, and they're usually patient-oriented outcome questionnaires. So those ones can be used most of the time during your follow-up. But there's people who like having the questionnaire at the beginning, and then they compare it during their second visit. So when we're talking about the process, we have talked about stage one, which is pre-fitting, the fitting stage, and of course the last stage, which is now the follow-up stage and rehabilitation stage. Remember, we have some patients who might have some cognitive issues that might require rehabilitative processes in hearing aid fitting. Or there are patients who you want to follow up in terms of care and management of the devices, and also you want to have the multi-stage approach when you're dealing with the hearing aid fitting. So all those things that when you take them in consideration are very important, and they're best practices that we employ and we use. Dennis, again, when we talk about hearing aid fitting, you cannot talk about hearing aid fitting without talking about counseling and training. And this, I think, we shall have a very good formal discussion of how to do it. You can have a questionnaire in your place. Like in my practice, I have a questionnaire after fitting, just to make sure that I have done all the trainings after fitting, and the patient is satisfied. And then the same questionnaire, you can reuse it again during retraining, going through some of the questions. Do they understand when to put the hearing aid on, when to remove it, and when to charge the hearing aid if it's a rechargeable type of hearing aid, and so on. All those things, if you have them in paper, they are very easy to go through and very easy to utilize them. And of course, during your second visit or follow-up, you talk about issues like fine-tuning of the devices, or just when patients are not comfortable with certain things like background sound, or certain fine tuning questions that have come in during your revisit clinic, then you can go through that and of course fine tune it. Some patients might not have the luxury of visiting back your clinic, and that is when telehealth or teleaudiology comes in, when we talk about remote fine tuning or remote helping some of these patients. So those are, in a nutshell, some of the things that we talk about when we are looking at best practices as far as hearing aids is concerned. Dennis, I'm back to you now.
Dr. Wahome, I am super delighted. Uh, it's cruising nicely. That's we are cruising nicely. So just to recap some of the things that you have said, a few things that we ought to look at. Of course, we have to do proper PTA. Just to add here, while we are doing that, please let's be cognizant of the fact that some of the patients who come for testing, obviously with hearing loss, might have a problem following your instructions. So make sure that you give clear instructions. It starts with there, those nitty gritties. If you give a patient a clear instruction on when to give a response, on what sounds or what densities of response to be able to respond to, so that to avoid getting wrong audiograms. So there is also, as you have mentioned, a need for us to have tests like UCL, just to be able to do a proper and comfortable fitting. And then, and additionally, I'd love that we also ought to look at the anatomy of the ear structure of the patient. By anatomy, we are looking at what sizes to be able to see if you need to put a mold, for instance, or if you need to put a dome. Or in case of a RIC fitting, a receiver in the canal, and you might need to customize a RIC receiver. You might want to look at, in case, for instance, a patient wants an AP receiver. AP receiver is an equivalent of what a BTE gain would give. So if a patient wants a RIC, but they have severe hearing loss, so you can't give them a normal receiver. So you want to add a bit of power into the receiver. We call it an absolute power receiver. So you have to look at the anatomy of the ear to be able to give, to be able to make sure that if the AP is molded, it will be able to fit properly into the patient's ear. Of course, we also ought to pay attention to the venting. As we always say, that a success of an audiological process depends on, number one, the comfort, the audibility, and intelligibility, or the speech clarity. So whenever we are talking about comfort, we are talking about eradicating things like feedback noise, eradicating things like occlusion. And when we're talking about occlusion, we are talking about venting. So you ought to know the venting options that are available. As it is, just to mention, the frequency to look at whenever you're deciding a venting size is the 750 hertz. And then the other thing that you ought to look at, of course, is choosing the power. You ought to give the right tool for the right job. You ought to give the right hearing aid for the right hearing loss. So whenever you're choosing the power, the frequency that you ought to look at is the 1500 hertz. And then again, just like Isaac has said, and I strongly agree, we ought to give realistic expectations from the moment go. The patient comes in, from the reception, good reception, of course. In case they have, they are using sign language, or probably they have enhanced the ability to lip read, please give clear instructions to your secretaries, to your front desk people, to be able to make sure that the connectivity and the connection between yourself and the client and the success of the entire process depends on the moment the patient comes in. If they do not understand something, let's say perhaps your front desk manager does not know sign language, advise them to write instructions so that there is that clear communication from the start. Communication is key. However way we have to achieve it, it is key and paramount in making sure that we are able to succeed in our audiological fitting. So we are so delighted that we have a whole lot of people, a host of people that have come in. We have Jasimak from Copperbelt, that's in Zambia. We have Abdi Said Garane from Somali. Of course, we have Hearing Health Talk from Tanzania. Yeah, so we are happy to have you. So, do you have anything to add, Mr. Home? Happy to have you. So, do you have anything
Yeah. So I think when you talk about, I don't know whether you can hear me. I think whether you can hear me. Dennis, you can hear me now? Dennis, you can hear me now?
Well, Mr. Home is getting himself. Okay, Mr. Home, please continue. Can you hear me?
Good.
Yes, continue.
So basically, Dennis, it's exciting when we talk about the best way we can manage our patients by making sure that we meet the expectations. A hearing aid instrument is really a powerful instrument. And the way I usually say it's like taking your device or a speaker, the way you listen to sound in your car with a speaker or a radio. It's not the same way you will hear it in a restaurant. It's not the same way you will hear it in an open environment. And when we are selecting hearing aids, sometimes one of the things that we need to select for a patient very carefully is the different types of memories that comes with hearing aid. We have memories that, with a touch of a button, it will change the entire environment because the ambient noise or the ambient sound that we hear in different environments is totally different. The way you hear in a restaurant, in a church, in an open ground, in an outdoor settings, or the way you hear in a phone is different. And therefore, one of the things that we need to add and we need to train our patient is how to use memories that comes with hearing aid. It's a game changer. It's a game changer that we should exploit as much as possible. Sometimes technology has come in for patients. Most patients, when they complain about hearing loss, they'll always complain about tinnitus. And when you're selecting these devices, it's good to select a device that can be able to help relieve complaints or issues that when we talk about tinnitus problems and so on. So that management of tinnitus with the tinnitus master is really another, game changer that we should take into consideration when you're selecting devices. And sometimes audiologists, there's a question: whether do I do it immediately or do I do it during follow-up, and so on. But those are some of the things that if we can add on as a list, because in 90% of the patients who presented to our clinic, they present with tinnitus, and it is very important for us to manage that part as well. The other important things that we have not mentioned is issues like battery life, or battery drain, very key. And sometimes, the cost of battery powered versus rechargeable hearing aids is totally different. And in our African setups, just to buy battery can cost a lot, because you calculate in terms of transport, in terms of the manpower cost of that you lose to look for batteries and so on. And these are some of the things that you should take in consideration even when you're selecting equipments or devices, and be able to advise your patients accordingly. So battery and power is very very key when you're selecting it, and you realize some of the newer hearing aids now they're advocating more towards rechargeable hearing aids. But now when you talk about people who are living in the remote areas where there's no electricity, it cannot be an option at that point. It can be a very good device, but again, power can be an issue for those kind of patients, and you don't want them to miss hearing aid even for a day. In our practice, what we usually say is we hate it when you put the hearing aid in the box and you do not utilize it. We like it when it is in the ear because this is why you came to look for us. And in most of the study, if you look at it, one of the reasons why people don't wear hearing aid includes things like noise or discomfort or pain when they are wearing their hearing aids and so on. And then you know very well more than me is that when you're selecting the hearing aids, like you're telling me things like ear mode, things like the receiver and the canal, how appropriate is it to the size of the patient? And with the best practice is you should make sure that the patient has the most comfortable fit you can ever have. And in terms of height, so that you can reduce even stigma. When your hearing aids are hanging like areas and they're not properly fit. And some of the times we meet some of these patients even in on the road, and we fix them even in the supermarket because you don't want a hearing aid that is hanging like an area all the way.
I know, man. I know, I know, I know. Obviously, this speaks
Back
to
to you,
how
Dennis.
passionate you are. Yeah, yeah, this speaks to how passionate you are about hearing health. And of course, I am a testament to that. Oftentimes, we see people doing it just as much they could be doing a job. When you're fitting a hearing aid, please remember that you are connecting somebody to a loved one. You're connecting someone to a potential job that they were at the verge or at the blink of losing. You're connecting someone to a marriage that they were probably at the verge of losing. So we ought to make sure that we get it right the first time. That is why we say that we always ought to get it right the first time. And so, saying, we do our best at Starkey to make sure that we give you all the support that you will probably need to be able to make sure that you do this and you get it right the first time. So, Mr. Home, I know there were some kind of questions that have been posed, and I was hoping you could be able to respond to them. There was a question that was asked about pediatric fitting. So, Mr. Home, how do you handle pediatric fitting at your clinic? Mr. Home, if you can hear me, how do you handle pediatric fits at your clinic? Alright, yeah, we have lost your audio again, Mr. Home. Uh, we have lost your audio. So we are learning a lot of lip reading today. Could you get your audio sorted, Mr. Home, so that we can be able to hear you?
Now
So,
it's back.
ladies and gentlemen, yeah, yeah, you can hear you now. It's back now. Oh dear, it's gone again. No, I can't hear you, man. No, just redo it again. Whatever you've just
It's
done,
back.
whatever. Yeah. You wanna try again? Continue. Oh, Mr. Homie, your audio seems to be having a bit of a challenge. Please get it looked at. Ladies and gentlemen, please feel free to toss your questions. We'll be reacting to them as we go on. Uh, so far, so good. Please, while Mr. Homie is getting his audio sorted, he is back. Can you hear me, Mr. Homie? Can Oh yeah, it's still not there. I can see you, but I can't hear you, sir. It's all right. So while you're getting it sorted, so ladies and gentlemen, we at Starkey are committed to be able to make sure that you get all the support that you probably need, and so we have with us. We would like to hear from you as well. even post training. So I would request that we bring our contact information so that in case we have clients, we have you here who would be interested to communicate with us directly. You probably would need educational, in case you need educational, how to manage tinnitus. Yeah, so somebody is asking, how do we get to manage tinnitus? I think this is a very interesting topic that was already asked as well by Grace in Nigeria. Tinnitus rehabilitation. So, as I mentioned, and like Mr. Wahome has ably put it, 90% of some of the complaints that we get in our clinics are of have some essence of tinnitus relationship. So tinnitus is very closely linked to hearing loss, especially persons who have presbycusis, that age-related hearing loss, that high-frequency hearing reduction, often tend to complain of things like I hear crickets in my ear, those high frequency tinnitus, or I hear just sharp ringing in my ear, those very high pitchy ringing in my ear. So tinnitus is very present amongst clients that we deal with on a day-to-day basis. And for this reason, and in full realization that tinnitus is a menace when it comes to hearing reduction, every of Starkey hearing aids has what we call multiplex tinnitus technology. This is a tinnitus rehabilitation tool that helps, with the help of artificial intelligence and pitch matching, to be able to undertake a tinnitus sort of masking and rehabilitation. This, though, is not an instant process. It's a process that goes over a period of time. For instance, oftentimes, of course, tinnitus rehabilitation starts with taking a good tinnitus history, actually, so that you can be able to get the proper situation of what the patient's experiences with tinnitus are, because it's always easier to treat something that you know from the start. So we have tinnitus rehabilitation technology in all of our hearing aids. And of course, in the course of our trainings, which will continue as we keep going, we'll be able to show you how to carry out. And of course, some of the people that I have interacted with in different countries that we have traveled to, we have done practical sessions on tinnitus rehabilitation, and we keep doing this. Should you have any more need for further training, we'll be giving you our contacts at the tail end of this conversation to make sure that we can be able to customize for you a session that can fit your training needs. Welcome back, Mr. Home. Can you hear me now? Please nod if you can. Shake. Yeah, you can hear me, but I still can't hear you, man. I yeah, you're doing, yeah. But before the end of today, you're gonna be very good at liberating. All right, man. All right, get back to it again. Just try getting it sorted, Mr. Home. All right. Yeah. Do we have any other question? Back end, could you? Do you have any other question? While we get other questions, Mr. Yoni, you're very welcome. So we, like I was saying, every of our hearing aid has a tinnitus masking technology, and of course, the hearing aid, whenever you put best fit, and then you, of course, you're able to activate the tinnitus maskers. It can be able to sort of do the tinnitus rehabilitations, which is a process that takes a period of time. Normally, in my experience, whenever I'm dealing with a patient and they come to the clinic and part of their complaints, for instance, of course, they come because they have hearing loss, and the other of their complaints is they have this constant ringing in their ear. What I do first is to try to find out what could be the root cause of this ringing sensation. Because oftentimes, tinnitus could be caused from things like high frequency hearing loss, like I mentioned before, things like noise exposure for a very long time. You get exposed to noise, but that is normally not very permanent. And then we have things like Meniere's syndrome or endolymphatic hydrops, that overproduction of endolymph in their ears. Oftentimes they come and they're like, I hear this roaring in my ear. So if you get a proper history from the start, then you are able to devise the best treatment option for that patient. In our case, if a patient has high frequency hearing loss and they have that crickety sound in their ear, Of course, the first thing that I normally do in my instance, I don't activate the tinnitus rehabilitation first, because high frequency hearing loss and there is and the related tinnitus simply means the brain is not getting sufficient high frequencies that it should be getting. So what do I do then? I ensure that I give sufficient high frequencies sounds by giving best fit for the hearing aids. And then over a period of time, after 3 months, 6 months, they come in and they're like, yeah, I still hear some bit of tinnitus, and then now you activate the tinnitus masker, and then it's a process that is not just a one-time sort of thing that you get able to do. As it is, obviously, we both know that a hearing sort of treatment is a relationship that you build from the moment a patient comes into your clinic up to, I don't know how long it could take. I have had testimonies from the likes of Dr. Mahin from Mombasa, who at one point told me the first patient they fitted is nearly 20 years now, like older, from the moment they did their first fit. So if you are going to spend that much time with a patient, you ought to make sure that you build that very solid and strong foundation from the moment they walk into your clinic. And that means then that we have to insist on you getting it right the first time. Please, whatever you need us to do to be able to help you to make sure that you know what you're doing in terms of fitting Starkey hearing aids, we are super delighted to be able to help. So once again, ladies and gentlemen, I think time is upon us. There is Mr. Garani. Hello, I want to tell me the Starkey company to get people in Africa cannot afford expensive hearing aids. Okay, when it comes to pricing of hearing aids, of course, we offer varieties for hearing aids for persons who probably can be able to afford, or persons who need more than just being able to hear, and they need a bit of luxury and a bit of comfort. So we have everything for everyone at Starkey Hearing Technologies. Mr. Home, do you want to try it again? Let's hear it.
I agree. I don't know. This time
There
they
you
want to
go.
breed me.
Good to have you,
Sorry, you
man.
have been
So let's.
rethinking me.
I had just asked how you undertake pediatric fittings, if at all, at your clinic.
Yes, we do a lot of pediatric fitting. Of course, the practice has always been the more you do, the more you have experience. I think the least age group I've done is a 2-month-old pediatric age group, and we get that.
Mm.
And when you talk about pediatric age group, you're talking from from months to below 14 years of age. So I think there's quite a number of that age group. And the biggest challenge has always been, especially when you have your ABR, and of course, I always insist on having ASSR, because it's the audiogram that is plotted with the ASSR that we use to program the hearing aids. And the biggest challenge with these young ones is they do not give you that wow expectation sometimes that you
I
see in
know.
adults. They don't
I
give
know. I
you.
know. I know.
Some of them you put the hearing aid and they start to, they start crying, and you're wondering, are you doing? And even the parents, they wonder, are you doing the right thing, or
Yeah, I
is there
know.
a
I know.
problem
I know, man. I
with the
know. I
hearing aid
know.
and so on? And it's really a challenge. You really need a lot of experience, and if you don't have experience with that, then you can always get mentorship and support from the seniors and so on. You had mentioned about tinnitus management, really a very important key. And one of the key thing about tinnitus is counseling your patient, telling your patient what is going on. In our population, people think probably, something wrong with their brain, some witchcraft going on, and so on. And the expectations, even with the hearing aid, after you have fitted hearing aid, is something that you really have to take in consideration every other time when you talk about tinnitus management. It's really a very tricky thing. Sometimes what I tell patients is your brain, it's like an alarm system. At some point, your brain will know when you have fitted the hearing aid, I have reached a level where my hearing is back to normal, and therefore that tinnitus system has to be shut down basically by the brain at the right time. Some people, prescribe a few medicines, some work, some don't work, and so on. But key is counseling, and of course, the tinnitus maskers that they wear really relieve them a lot. Yeah.
Right, sir, thank you very much, and thank you so much for your time. Yeah, so I think we are winding up now. And as we wind up, I just want to thank you so much, Mr. Home, for creating time. I hope we can be able to continue this conversation, of course, as the days go
Absolutely.
by, for the betterment of our people in
Absolutely.
Africa, of course. Yeah.
Mm-hmm.
Thank you so much, man. I appreciate you. So, ladies and gentlemen, as we wind up, as we come to the tail end of all this, in case you have any questions and any concerns, or you have any requests for training or further training, personalized, just to fit your training needs, please feel free to email us on the information that has been sent here. Or in case you want some to order hearing aids, perhaps, please go ahead and make inquiries through the numbers that have been provided here. And then we would also love to hear from you. In case you have any feedback that you would like us to have, please go ahead and scan the QR code. Take a screenshot, scan the QR code. We'd love to hear from you. Suggest for us some of the things that you'd like us to have to tackle, because in so doing, we are able to create real impact. And like I said from the start, we do this for the betterment of our people, the clients that come to see us every other day. So, once again, thank you all, ladies and gentlemen. And as we wind up, we have something that is cooking. In Africa, we are bringing in a new baby. We are extending everything to the very edge, the edge of hearing. We have had Genesis for the longest time, and that was our premium hearing aid. And we are just about getting ready to introduce a new edge of hearing aid. And we are going to bring in the best of the best. Genesis was good. It is much better. So for the first time, we are going to introduce it in Africa, and very soon we'll be starting our master classes just to be able to usher you into this new generation of Edge AI. And of course, we look forward to being able to interact with you. Ladies and gentlemen, thank you all so very much for creating time to be able to join us, and we hope to be able to hear from you. In case of any need of any information, please reach out to us. We'll be delighted to respond. Thank you also very much, and good evening, good afternoon, and goodbye from wherever you're joining us. Thank you all very much.